Alcohol addiction, comprehensive overview. Alcohol addiction. Alcohol addiction, also known as alcoholism or alcohol use disorder (AUD), is a chronic and often progressive condition where an individual becomes physically and psychologically dependent on alcohol. It is characterized by a strong urge or compulsion to drink, inability to control alcohol consumption, and a tendency to continue drinking despite negative consequences. Epidemiology of Alcohol Addiction Part 1. Global prevalence. Alcohol addiction is a widespread issue, affecting individuals across the globe, though rates vary depending on geographic region, cultural factors, and socioeconomic status. Global estimates. The World Health Organization, who estimates that approximately 5.1% of the global population ages 15 and older suffer from alcohol use disorder, with higher rates in Europe, North America, and Oceania. Regional variations. Europe has some of the highest rates of alcohol consumption, particularly in countries like Russia, Ukraine, and the Baltic states. The Americas. Alcohol addiction rates are significant in the US, where about 14.5 million adults are affected by alcohol use disorder. Asia and Africa. Though alcohol consumption is lower, problematic drinking rates are rising in certain countries, especially with increasing urbanization and globalization. Epidemiology of alcohol addiction. The second. Age and gender factors. Age. Alcohol addiction often starts during adolescence or early adulthood. It is particularly prevalent among individuals aged 18-29, but it can affect older adults as well. Gender. Men are more likely than women to develop alcohol use disorder, but the gender gap is narrowing in many regions. The ratio is typically 2:1, with men being at a higher risk. Women tend to develop alcohol addiction at lower levels of consumption and often experience more severe physical and psychological consequences at lower drinking levels. Comorbidities and risk factors. Individuals with a family history of alcoholism are at a higher risk. Mental health disorders like depression, anxiety, and PTSD are common among those with alcohol addiction. Social and environmental factors, such as peer influence, trauma, and stress, also play a significant role. Symptoms of alcohol addiction. Alcohol addiction presents a range of physical, psychological, and behavioral symptoms. These can vary in intensity depending on the stage of addiction. Physical symptoms. 1. Tolerance. Over time, the individual requires more alcohol to achieve the same effect. 2. Withdrawal symptoms. These occur when alcohol use is reduced or stopped. Symptoms may include tremors or shakes, sweating, anxiety or nervousness, nausea and vomiting, seizures in severe cases, hallucinations, delirium tremens. 3. Drinking to avoid withdrawal. A person may drink more frequently to alleviate or avoid withdrawal symptoms. 4. Health problems. Chronic alcohol use can lead to liver damage, cirrhosis, pancreatitis, gastrointestinal bleeding, and cardiovascular issues. Psychological symptoms. 1. Cravings, a persistent desire or strong urge to drink alcohol. 2. Loss of control, inability to limit the amount of alcohol consumed despite repeated attempts to do so. 3. Neglecting responsibilities. Work, school, or family responsibilities are often neglected due to drinking. 4. Denial. Individuals may deny that they have a problem or may minimize their alcohol consumption. Behavioral symptoms. Behavioral symptoms. 1. Preoccupation with alcohol. Spending significant amounts of time obtaining, using, or Recovering from alcohol. 2. Relationship problems. Alcohol addiction can strain relationships with family, friends, and coworkers. 3. Engaging in risky behaviors. Driving under the influence, engaging in unprotected sex, or making impulsive decisions while intoxicated. 4. Social isolation. With increasing addiction, individuals may withdraw from social activities that don't involve alcohol. Treatment for alcohol addiction. Alcohol addiction is a treatable condition, but overcoming it often requires a combination of medical, psychological, and social interventions. Treatment should be personalized to meet the unique needs of each individual. One. Detoxification and medical management. Alcohol detoxification. The first step in treating alcohol addiction is often medically supervised detoxification detox. This process helps manage withdrawal symptoms and allows the body to rid itself of alcohol. Medications may be used to ease withdrawal symptoms and prevent complications, e.g., benzodiazepines for anxiety and seizures. Inpatient or outpatient detox, depending on the severity of the addiction, detox can be done in a medical facility or at home under supervision. 2. Behavioral therapy. Cognitive behavioral therapy, CBT, a widely used form of psychotherapy that helps individuals recognize and change problematic thought patterns and behaviors related to drinking. Motivational interviewing me, a therapeutic approach aimed at enhancing motivation for change by resolving ambivalence. Contingency management CM, a form of behavioral therapy where positive behaviors such as abstaining from alcohol are rewarded. 12-step programs. Alcoholics Anonymous. AA is one of the most well-known support systems, based on the principles of mutual support and accountability. These programs are widely available in most countries. Three. Medications for alcohol use disorder. Several medications can help individuals reduce or stop their alcohol consumption. Disulfiram antabuse causes unpleasant physical reactions, nausea, vomiting if alcohol is consumed, creating a deterrent for drinking. Acamprosate Camprol reduces the desire to drink alcohol by affecting the brain neurotransmitters. Naltrexone blocks the pleasurable effects of alcohol, reducing cravings and the urge to drink. Topiramate, an anticonvulsant that has been shown to reduce alcohol cravings and consumption in some individuals. 4. Supportive programs and social reintegration. Outpatient rehabilitation. Many individuals choose outpatient rehabilitation, where they attend therapy sessions while continuing to live at home. Inpatient rehabilitation. For individuals with more severe alcohol dependence, inpatient programs provide intensive care and support. Sober living houses. These are group homes for individuals who have completed detox or rehab but need additional support in transitioning to independent living. 5. Family therapy and social support. Family therapy involves family members in treatment to address dysfunctions and improve family dynamics, as addiction often affects the entire family. Support groups. Support groups such as Alcoholics Anonymous AA and Smart Recovery provide a sense of community and shared experience, offering vital emotional support and accountability. Educational programs. These programs aim to educate individuals and families about the effects of alcohol addiction and the treatment process. 6. Long-term maintenance. Recovery from alcohol addiction is often a long-term process. Many individuals continue with therapy and counseling to manage triggers and prevent relapse. Regular attendance at support groups like AA or Smart Recovery. Lifestyle changes such as developing new hobbies, focusing on health, and building a supportive network of sober friends. Conclusion. Alcohol addiction is a serious and complex condition that affects millions of people worldwide. It is influenced by genetic, psychological, and environmental factors, and can have severe consequences on health, relationships, and overall well-being. However, alcohol addiction is treatable. A combination of detoxification, behavioral therapy, medications, and strong social support can help individuals recover and lead fulfilling, sober lives. Early intervention, personalized treatment plans, and long-term commitment to recovery are key components in overcoming alcohol addiction.